Welcome to Business Connection. I'm Liz Spencer. Hey, we have two wonderful guys in studio today that I want you to meet. They're from Associates in Family Care. I have Dr. Doug McKinley and Dr. Jim Shalley with me. Now, Doug, let's start with you because you're the owner and founder of Associates in Family Care. Tell me a little bit about it.
Associates in Family Care was an outgrowth of my passion to connect with people and help. I got a memory from childhood. My father asked me when I was 17, what are you going to do? And when you're, as you leave high school. And he was one of those very unique stories that he told me about the exciting possibility of helping people through the field of psychology. And from age 17 until 29 when I completed my doctorate degree, very, very passionate and very focused on finding ways to serve others through this. Back then it was kind of an exciting emerging field of psychology. Now it's very popular. And so in 1991 I had graduated and just launched off on my own and started Associates Family Care essentially as the next step from earning the degree. And just found myself in this sort of growing area called Naperville, and wow, I had no idea it was going to just continue to blossom and be just a really great place to serve families, especially during the 90s and the last 10 years.
Oh, wow, that's a terrific story. Mm-hmm. Jim, tell me some of the situations or issues that people are coming in to see you and your other associates these days.
We deal with a variety of issues from anxiety and depression to more life transitions like divorce, step parenting. We do a lot of that. But usually it's the standard kind of dynamics as far as people feeling anxious about their lives, they're transitioning in jobs, they've lost a job in the economy the last few years. That's been an issue that a lot of people have come in with. But we deal with children, adolescents. We have therapists with a range of expertise in all those areas.
Marriage is another big, very popular.
We do with a lot of marriage. Yeah.
Right, so kids, adolescents, adults, elders.
Yep.
So all demographics.
Yes, we do. Mm-hmm.
So how does someone know that they may need some counseling? How do we get that idea that we should be seeking
Usually their
some
family
help?
or friends kind of encourage them to see someone because they're tired of listening to them, perhaps.
And we all think they're joking, but they're really trying to tell us something.
Exactly. I think, again, when you're feeling anxiety, if you've lost a job, if your marriage is in trouble, if you are really just kind of a sense of unhappiness in your life, those are all precursors to saying, okay, do I need to talk to somebody? And I think any of us can benefit from external voices in our lives to kind of keep us on track a little bit. But again, more of the acute situations where people really are struggling, and they will ask, and say, am I doing okay? And then to be honest and be a good friend is to say, well, maybe it would help to talk to somebody.
So
a lot of women will say their husbands need to go to therapy all the time. So
right.
That's
well, that may be true, but so we've got that external cue from someone saying, hey, maybe you should talk to someone because I don't know what to tell you anymore.
Right.
Mm-hmm. How do they find someone, or how do they know if that fit's going to work? And how
most of the referrals that come to me personally are personal referrals. Okay. In other words, a
friend of a friend.
A friend of a friend, yeah. And then a lot of people will go on the internet and read your bio. And I had several cases this week where that's been the case. They've read my bio and
they look at your picture.
For some reason they've seen something okay in that. So
we've studied this for more than 10 years now,
right.
And it's north of 60% of our referrals come from positive
doing good work, basically.
Positive outcomes from good therapy.
Yeah.
That's great.
So it's friends trusting, hey, I go see this guy, go see this person, this lady. She's really good.
And do you find people are talking more about therapy?
I do think it's more normal. I mean, people are much more comfortable with the idea of therapy. Even for teenagers to say, I'm going to go see my therapist, or I have a therapist. I mean, it certainly has shifted in the last 10 or 15 years. People much more open to the process.
Well, I think that's helpful. I mean, I think that helps you guys, but I think it helps in general to be a little bit more open about it.
Absolutely.
So if someone goes on the internet, sees your picture, reads your bio, and say, hey, this guy has some expertise or some familiarity with what I'm feeling, what happens next?
We have a great staff. So if they call our number, Donna is the lady that is the intake, and she takes all the insurance information if they have insurance, and then she kind of directs to me, and then I determine pretty much which therapist it would be best suited for the situation that they call about.
And how long term is this? I think people wonder if they get therapy that
For the rest of their lives.
Right? No, but I think people wonder, how long do I need to chat with somebody, and are you trying to help me cope with something or learn my own skills on coping through this?
That's a great question. With the insurance shifts and changes,
right. There's usually
lots of dynamics.
Insurance tells us how long we have. There's a finite time.
Yeah, I think people would like to use it for personal growth, and so I'd say it goes seasonal. Like people go through a transition in their life. They come into therapy, need some help, and then they may come back a few years later because something else has traumatic happened.
Not to scare people, but I've seen people for 10, 15 years. Off and on, but they'll come back and forth and do that.
Yeah.
Marital cases depends on the motivation of the clients. For marriages specifically, if they're pretty motivated, you can make a quick shift within a matter of a few weeks. Other cases are more entrenched. After 20 years of marriage, it's much more difficult to sort out all the issues. But I would say anywhere between 3 to 6 months to a year.
The average lifespan of a client in our practice is about 15 to 20 sessions.
Okay.
So that's average. That's taking all the outliers into play, too.
Now, there's lots of choices out there. What distinguishes your group from the rest of them?
I think there's a lot of great practices in the area. We've been around for a long time. We have colleagues in the area that have been on your show. So I think for us, we've been here since 1991. So I think the credibility in the area, still in practice. Jim and I both been around that whole time. I think the experience, we do about 5,000 conversations a year in our combined practice. So we've been there and done that and had a lot of conversations. But I think the best differentiator for us is our service. We do have a full-time staff that greet you when you come in. Healthcare insurance is the biggest constraint to getting into some of these things. And we call and check benefits for you still. We're still very old-fashioned in that regard. And we have somebody, not every night, but Monday through Thursday, we have somebody, a receptionist there till 9 o'clock, 8 o'clock. So we feel like our service is still that sort of full service. It's kind of gone by the wayside from what I understand from our competitors. So I think service is something that would definitely differentiate
And
us.
I do think we provide really excellent care for the clients as well. But again, that's would be my bias. If I didn't say that, it'd be kind of weird, wouldn't it?
It would, but I think you guys have brought a lot to the area. I mean, to be involved in the community for so long says a lot. So
sense of humor. I think our therapists are very good at that. He's especially good. On the
website, I use humor in my sessions. A lot of people will comment when they make an appointment with me. That's one of the things that was attractive. Now, sense of humor is subjective sometimes, so yeah.
But one would not always expect that with this.
That would be true. Yeah.
We have to learn to laugh at ourselves and our situations. So it's just when I walk by the offices and the doors are closed and I hear laughing, I know that something meaningful and a connection is happening.
And they're not laughing at the therapist.
Well, sometimes they might.
They say laughter is the best medicine.
Yes, that's very true.
Thank you for stopping by and showing what you do and helping people.
Thank you for allowing us to be here.
Not at all.
Thank you very much.
We're going to be right back with more Business Connections. Stay tuned.